may proceed.
My name is James Filkins. I'm a forensic pathologist based in the greater Chicago, Illinois area. I want to thank Vaclav Pericevic for inviting me to present my opinions in the matter of Petr Kramny at this meeting. Given that I have been allotted only about 10 minutes, I believe that the most useful way for me to present my opinions is by reading my affidavit into the record. I will do that now. I, James A. Filkins, MD, JD, first being duly sworn according to law, declare I am a doctor of medicine exclusively specializing in forensic pathology. I have been continuously licensed as a physician in the state of Illinois, USA, since 1993. Over the course of more than 30 years of active practice, I have personally conducted over 10,000 postmortem examinations, including examinations of including examinations involving electrical injury. A copy of my current curriculum vitae is attached as Exhibit A to this affidavit. In July 2025, Professor Mark Godsey of the University of Cincinnati, Ohio, USA, College of Law, forwarded to me a request for assistance from Spolek Salomon regarding the deaths of Monica Kramny and her daughter Clara. On July 30th, 2013, Monica and Clara Kramny were found dead in room 6343 at the Titanic Palace Hotel in Hurghada, Egypt. The question presented for my review and opinion was whether there was any pathological evidence based on the post-mortem examinations of Monica and Clara Kramny to indicate that the cause of their deaths was electrocution. Accordingly, I have reviewed a variety of materials provided to me by Spolek Salomon. The materials I have reviewed include the reports of the post-mortem examinations of Monica and Clara Kramny, conducted in Egypt and subsequently in the Czech Republic, a video recording of the post-mortem examinations conducted in the Czech Republic, post-mortem photographs of Monica and Clara Kramny taken in Egypt and in the Czech Republic, photomicrographs of tissue samples removed post-mortem, investigative reports, and the reports and statements of other medical experts. Low voltage electrocutions often, but not invariably, produce characteristic burn marks on the skin. Firm contact of the skin with the source of the electrical current may produce a blister with a pale ring surrounding a central crater. If the source of the electrical current remains active and in contact with the skin for a protracted length of time, then a larger, more severe burn can be produced. If an air gap exists between the skin and the source of the electrical current, a spark burn may occur if the current arcs across the gap. Spark burns appear as small crusted nodules of tissue surrounded by pale areolas. Microscopically, the skin of an electrical burn may show separation and necrosis of the epidermis, as well as bubbling or vacuolation of the epidermis with elongation and streaming of the individual cells of the epidermis and their nuclei. As many as 50% of low voltage electrocutions, however, leave no burn mark, according to a Miami, Florida study by Dr. Joe Davis and others published in the Journal of Forensic Sciences in 1980. Electrocution is, however, never a diagnosis of exclusion or a default diagnosis. Accordingly, standard forensic practice requires that the investigation of any suspected low voltage electrocution includes a thorough examination of the scene to identify the source of the electrical injury. The hotel physician at the Titanic Palace Hotel, who first examined the bodies of Monica and Clara Kramny when they were found on July 30th, 2013, estimated that they had been dead approximately 3 hours. Seen photographs of the hotel room in which Miss Cramney and Clara were found show them each lying in a supine position in separate beds. The position of Clara's right arm suggests that she may have been in rigor mortis at the time the photograph was taken. No signs of decomposition on either body are visible. Dr. Nagy performed the first Dr. Nagy performed the first autopsies of Monica and Clara Cramney on July 31st, 2013 in Hurghada, Egypt. Dr. Nagy's examination, as reflected in his postmortem report, found no evidence of any electrical injury or any other signs of violence on the bodies of either Monica or Clara Cramney. Postmortem photographs taken at the autopsies in Egypt of Monica and Clara Cramney show no electrical injuries or any other injuries to the body, apart from a purple bruise on the side of the left thigh of Ms. Cramney and a purple bruise on the left knee of Clara. Investigative reports by Egyptian authorities provide no indication of any power outage, faulty wiring, defective appliances, or other electrical apparatuses in the room that could have caused or indicated electrocution. The bodies of Monica and Clara Cramney were transported back to the Czech Republic on August 8, 2013. On August 9, 2013, Monica and Clara Cramney were autopsied a second time in Ostrava, Czech Republic. A video recording was made of these second autopsies. As shown in the video recording of the autopsies, the bodies of Monica and Clara Cramney were each wrapped in a white fabric shroud. Each body was then wrapped in a plastic tarpaulin, which was firmly secured in place with a white fabric binding that was looped snugly around the body at various locations, including the neck and ankles. When the tarpaulins and shrouds were removed, it was obvious that the bodies had undergone significant decomposition changes in the 9-day interval between the first autopsies on July 31st, 2013, and the second autopsies on August 9th, 2013. On the back of the neck of Monica Cramney, there was a mark, which the pathologist who performed the autopsy interpreted as an electrical burn, leading to the conclusion that Monica and Clara Cramney were electrocuted. No mark is visible in the photographs of the back of Monica Cramney's neck that were taken at the first autopsy in Hurghada, Egypt, nor was such a mark identified by Dr. Nagy or other Egyptian doctors. No mark was identified on the body of Clara Cramney at either the first autopsy in Egypt or the second autopsy in the Czech Republic. A sample of skin from the back of Monica Cramney's neck, as well as sections of cardiac tissue from both Monica and Clara Cramney, were taken for microscopic examination. The mark on the back of Monica Cramney's neck, seen in the video recording in the Czech Republic, can most accurately be described as a discontinuous furrow that is darkened because of decomposition changes and postmortem desiccation. The skin appears torn or lacerated. There is no blistering or burning of the skin, and the margins lack the pale areola that is often seen in electrical burns. As shown in the video recording of the Czech autopsy, Ms. Cramney lay in her coffin in a supine position so that the posterior portions of her body bore her weight. There was sufficient space within the coffin for her body to have shifted somewhat over the course of its journey from Egypt to the Czech Republic. As seen in the video of the Czech autopsy, there are narrow indentations or creases on Ms. Cramney's back and buttocks caused by the weight of her body pressing into the folds of the shroud and plastic tarpaulin against the bottom of the coffin. There are also shallow postmortem abrasions visible on Ms. Cramney's back. These postmortem abrasions were caused by a combination of the pressure from her body weight against the shroud, plastic tarpaulin, and bottom of the coffin, and the friction produced by her back rubbing against these surfaces as her body shifted during transport. Neither the indentations nor the abrasions were present in the photographs taken at the Egyptian autopsy. The relevance of these considerations to the question of electrocution is significant because the location of the mark on the back of Ms. Cramsey's neck corresponds to the location where the binding was snugly wrapped around the neck. Accordingly, the pressure of Ms. Cramsey's body weight against the shroud, plastic tarpaulin, bottom of the coffin, and the binding, as well as any shifting of her body during transport, would also have produced the mark to the skin on the back of her neck found at the Czech autopsy. In my opinion, the mark on the back of Monica Cramney's neck is simply a postmortem artifact caused by the manner in which the body was shrouded, wrapped in plastic, bound, and positioned in the coffin. It is not an electrical burn. The Czech autopsy report described the histological appearance of the muscle fibers of the heart tissue as consisting of wavy or zigzag fibers, a finding interpreted to be consistent with electrical injury. Wavy or zigzag heart muscle fibers can be seen in deaths from many different causes. It is so commonplace and non-specific a finding as to be of no diagnostic significance at all. The Czech autopsy report also described the histological appearance of the cross-section of skin taken from the back of Ms. Cramsey's neck as showing thinning of the epidermis at the central portion of the cross-section, filamentous elongation of nuclei and crowded and pycnotic nuclei in the thinned area, and focal loosening of the connective tissue of the subcutis. These findings were also interpreted as consistent with electrical injury. The histological appearance of the cross-section of skin from the back of the neck shows nothing more than sloughing away of some of the most superficial layers of the epidermis, a finding to be expected given the decomposition changes and the appearance of the mark on the back of the neck. The cross-section of skin lacks the bubbly coagulation necrosis and nuclear streaming often found microscopically in the epidermis in electrical burns. There is no vital reaction. That is, the mark on the back of the neck did not arise while Monica Cramney was alive. The histologic appearance of the cross-section of skin is, in my further opinion, also nothing more than a postmortem artifact brought about by the decomposition of the body and the postmortem mark to the back of Ms. Cramney's neck. Accordingly, based on my review of the materials provided to me, as well as my education, training, and experience in forensic pathology, it is my opinion, to a reasonable degree of medical certainty, that the cause of death of Monica and Clara Cramney was not electrocution. A written copy of this affidavit is attached as Exhibit B. And that concludes my reading of the affidavit. Once again, I want to thank Mr. Parachevic for inviting me to present my opinions at this meeting. And I want to thank those of you in attendance for your attention in listening to my presentation. Thank you very much.